Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today I am going to talk about what medicines are required after embryo transfer in a test tube baby patient. Now this is a very common apprehension of the patient that doctor, we want to get test tube baby done, but we are extremely afraid of the injections, and after the embryo transfer will we have to take injections continuously? Is it very painful? And so today I thought of discussing this important topic. Now what happens is, how we do test tube baby in our center is mostly by frozen embryo transfer technology, which has been discussed in the previous videos. So in the first cycle, we make our embryos ready, we freeze them, and then when the period comes naturally, that period we start making the endometrial lining for embryo transfer. Now during this cycle, the patient has to take only oral medicines. She is not given a single injection, and roughly after 2 to 3 weeks, when her endometrium crosses 9 millimeter, which is an optimum thickness for deciding the embryo transfer procedure, that is when she is admitted for an embryo transfer. Embryo transfer is done without anesthesia. The patient needs to be there in the operation theatre hardly for 15 to 20 minutes time, and it's a day care procedure. Once the procedure is done, if she is a low risk patient, which means that she has not failed any procedure previously, or she is a simple patient without any high risk issue to her IVF, then she has to take only oral medicines and vaginal gels and certain vaginal medications for the next 15 days till her pregnancy test is done. She is not advised any injections of any sort absolutely, because she is a low risk patient, and the oral and vaginal prescriptions do have equal efficacy, and it has been proven by various studies and research as well. However, on the other hand, if she is a high risk patient, by which it means that if she has failed her test tube baby cycles previously, or if the duration of marriage is too high, like 10 years, 15 years, if she has been a previously operated patient for removal of fibroid surgery or endometriosis or any high risk factor which adds up to her IVF procedure, this is the patient which might require injections to increase the blood supply which is delivered by the uterus to the child. These injections are low molecular weight heparin injections or progesterone injections, which can be taken by the patient all by herself. We train the patient for that, and these are absolutely painless injections, and she can inject herself for the next 15 days. So by and large, if we consider the statistics, around 80% of test tube baby patients get pregnant only with oral medicines or vaginal medications and gels, and only those high risk 20% of the patients might require daily injections to be taken to give an external or artificial support to the nutrition which is supplied by her own uterus. Thank you.